This is another edition of the Ministry of Health's Week in Review. Here are the highlights from this past week. On May 10th, 45 healthcare providers from across Guyana embarked on a training program in tropical chronic disease research. To enhance their skills to effectively tackle chronic illnesses at the Ministry of Health conference room on Berg Dam. Through a hybrid approach, the training sessions will conclude on May 31st, 2024. The Health Minister, Honorable Dr. Frank Anthony, stated in his feature address that the course offers opportunities for exchange between China and Guyana.
We have a very strong bilateral relationship with China, and some of that relationship predates even the establishment of our diplomatic relationship, because we had Chinese immigrants that came to Guyana a long time ago, since 1853. And so we've always had this linkage with China. But these linkages were more formalized when we established formal diplomatic relationship. And from then, we've had the good fortune of working very closely with China in the area of health. We've had several brigades that came to China, and they came to Guyana offering services, medical services at our different hospitals. And I see in recent times that we have extended those services where some of the teams are even going out into the communities and helping those specific communities, and that's a good thing.
Meanwhile, Chinese Ambassador to Guyana, Mistress Guai Haiyan, in her remarks expressed gratitude to the Minister of Health and the Southern University for facilitating this program. She mentioned that this course is one of 5 to be offered by the government of China. On Saturday, May 11th, the Honorable Minister visited Region 1 to conduct the regional launch of the long-lasting insecticide-treated nets campaign. This initiative aims to reduce the transmission of malaria by providing barriers against mosquitoes carrying the disease. The campaign targets the most vulnerable populations, particularly those residing and working in mining areas where malaria risk is high. The goal is to ensure that every family, child, and individual has access to necessary protection. During the visit to Region 1, Dr. Anthony commissioned a new health worker living quarters at Sabai at a cost of 12.9 million Guyana dollars. In his brief remarks, Minister Anthony affirmed the Guyanese government's dedication to bringing transformative changes to every corner of the country.
One of the things that the PPP civic government has been doing is to bring transformation to every part of Guyana. Doesn't matter where you live. Because when we were campaigning, we were saying to people that if you elect us, we are going to ensure that development comes to every single village of this country, however remote. We want to make sure that that happens.
Additionally, the Health Minister recommissioned the new Canal Bank Health Post in Region 1, which amounted to some 30 million Guyana dollars. The development of this new health facility is expected to significantly improve services in primary health care, maternal and child health, elderly health, men's health, laboratory, pharmacy, and general outpatient, among others. In his brief remarks, Minister Anthony noted that the government is committed to improving every healthcare facility in Guyana. As we conclude this week's recap, let's also acknowledge World Hypertension Day. Remember to limit your salt and sugar intake. Until next time, stay well.